We have a lot of great presenters and great content for you. We are going to explore 3 different kinship assessment tools. One that is focused on licensing kin who will serve as foster parents for children, for their kin children. And 2 that are used by Kinship Navigator programs to provide services and supports to all kinship families, whether child welfare involved or not. One is Washington State's, and then the other is Port Gamble Skellum Tribe's adaptation of that, cultural adaptation, because they work very closely together, Port Gamble and Washington State. So a lot of great presenters today. I'm just going to kick us off with just a little bit about the network, and then I will turn it to Washington State. For those of you who haven't joined one of our webinars before, we are the first and only federally funded National Technical Assistance Center on grandparents and other relatives and kin who raise children when parents can't. Wow, that's a mouthful. And rather than serving the families directly, because local communities do that best, what we do is work with government systems, nonprofits, tribes, through our partner, the National Indian Child Welfare Association, in that kind of umbrella of agencies and systems that you see on your screen. We do that with a number of partners and subject matter experts. So we really are here for you. We have individual assistance, which if you go to our homepage, which the link is there at the hyperlink, go to our homepage on the top right, it says request assistance. You just complete that form, and one of our fabulous TA specialists, Shayla Bottoms or Kylie Craggett, will get back with you, and they will bring in subject matter experts and partners as needed. We also host essentially monthly webinars, including this one today, and an array of learning communities. So do a lot to try to help you better serve the families. This is an image of our homepage, and that, as you see in the top right, is the request assistance button. It's just a short form, but it helps us better track our technical assistance so we can get back to you in a timely way. And then please sign up. Well, actually, we're going to sign you all up unless you tell us not to, for our monthly newsletter. We only send it out once a month, and it is just really full of great resources, everything we know actually that's happening nationally around kinship care. So from partner agencies, from the government, funding opportunities, all the things we do as well. And then please follow us on LinkedIn. We have very active posts, at least 3 times a week, where we share the latest and greatest. And again, it's not just our work, it's the work of our partners and others in this field. So with that, it is my pleasure to turn it over to Roz Alber, who is a longtime friend of Generations United and our Grandfamilies and Kinship Support Network, and who runs the Kinship Navigator program that just got in the Title 40 Prevention Services Clearinghouse. Congrats, Roz. So turning it over to you.
Thanks, Anna. It's been it helps to take it. It's just been an exciting time, and I appreciate all the support. And just wanted to kind of briefly give you a PowerPoint to talk a little bit about the development of our kinship needs assessment, and so that you had a little background on how that was developed. I also have links here on our top page about the Washington State Kinship website, where you can find more of our information, as well as a link to our Kinship Navigator training manual to give more details about how to utilize this assessment tool. Next slide, please. So our Kinship Navigator program is part of a Kinship Care Oversight Committee that is statewide mandated, where we have participants that are caregivers, kinship navigators, tribal navigators, researchers, state agencies, and other nonprofit programs throughout the state. And these are all a part of this committee that meets on a regular basis to provide oversight and suggestions and support to the kinship programs in Washington. And we had a subcommittee that was developed to really hone in on making all the details of this assessment so that we could use this tool in this research project. Next slide, please. This whole needs assessment is basically a bunch of demographics about the caregiver and the child or children in their home, as well as some other tools in it. And it takes a lot of time to do the first assessment tool with a caregiver. It could take from an hour to an hour and a half. And so because it's so dense and it has so much information, but as we developed this tool, even though it was pretty lengthy, we just got more and more feedback from the folks that were putting this together that those questions did need to be asked. So even though they were pushing back and saying this is going to be so much, but at the same time, they didn't want to let anything go. So it's just been this ongoing opportunity to really get a deep dive into the situations in the household so we can provide the best supports and resources to them. So you can see just basic information is gathered here and information too about the child's physical and behavioral health and how they're doing in school. Next slide, please. And then a little bit more detailed information about assessment kinds of things like their needs for rent, utilities, education, other kinds of things. And I'll show you the actual assessment here momentarily so you can kind of get a better sense of what's there. But I just wanted to give a brief overview. Next slide, please. And then the topics continue. We're asking about, are you getting emotional and support about your circumstances? And do you have someone to talk to? Healthcare for yourself, healthcare for the child. Do they have other kinds of needs that might be prevalent in their circumstances? Next slide, please. And then we have the actual needs assessment goal section where they've looked at the needs that they addressed earlier in the assessment, and now they're developing goals with the Kinship Navigator to decide on what do you want to work on going forward. So we're suggesting that they work on 1 to 3 goals and keeping it simple using the SMART goals type of technique so that it's a measurable outcome in a shorter period of time. Next slide, please. And then with the case management model, they're going to have a follow-up with a navigator at 3 and 6 months. And the needs assessment has opportunities for them to fill out the follow-up information in there. Next slide, please. And then we use a fidelity tool that helps to keep track of the time frames that are involved when you're working with a family, making sure that you're meeting that 3 and 6 month follow-up time frame and checking on goals achieved, checking on the status of the child in the home. Maybe they left the home because they went back to the parent, those kinds of things. So it's really helping to ensure that the fidelity of the model is being utilized. And I think that is the last of the slides. So with that, here's my contact information. Please feel free to reach out if you have any questions. So now we can move on to the actual assessment tool. Is that working, Ro? I think he's trying to pull it up. Yeah, perfect. So if you could go to the next page, please. This kind of shows just, again, the demographic information. And then we're going to keep on scrolling down. I don't want to go over time, so I'm trying to be mindful of that. Here you can see just more. Oh, I think this is Cheryl's version of the assessment. So I will ask that we wait on this one because it's got some specific information in here that would be helpful. Do you want me to share my screen, Ro? I can share my screen if I have the ability to do that. Yeah. Yeah, I think that's the correct one. Thank you. So Cheryl will talk about the modified version of the needs assessment in a bit. This is just basic demographic information. And as you can see, Um, it's all basic information. Next page or next slide. We're asking for basic demographic information on their household income, that kind of thing. It's all pretty generic. Next slide. We're going to just breeze through this. Demographics, more demographics, and you can keep going. Information about school. And then this is more about their employment and household income. You can keep going. And you might notice at the top in the kind of grayed out section, that's for the 3-month follow-up, because you may not have to ask every single question, but you could just go through and just say, hey, has anything changed in the past 3 months in this category? And make it a quicker overview of what's going on in the household during that time frame. You can do the next slide, please. And then more information about the relationships in the household, and we can keep on going. More about behavioral health, medical health. We're asking information about the health of the child as well as the caregivers. And then you can keep going. And then again, more health information. And then the client signs it. And this is the needs assessment part where we're asking about the need in the family. What kind of resources are they currently using or do they need? And then the frequency of their use. If they did use a resource in the past 3 months, how frequently did they need it? And so that kind of gives us a sense of patterns that might be occurring, ongoing needs, that type of thing. You can keep going. And again, more of the same categories. And I think we can just keep on going for the next 2-3 slides here because it's just those same categories. And now we're working on the goal setting based on those needs that were that came to light in that previous section. So the caregiver would determine what kind of goals they want to work on first and the level of need within those goals, how important that is to them, and then how confident they feel that they can work on that. And then there's this section on here about the follow-up that the navigator fills out later on, where the goal status section on the left lower corner, where it shows if the goal is completed or if it is no longer relevant, that type of thing. Okay, next slide. And then here's the next, like if they were going to do goal number 2. And I think that's probably close to the end, or if it's not, it's, there's like one more. Yeah, I think that's about it. So like I said earlier, they would work on, say, 2 to 3 measurable goals and then follow up at 3 and 6 month time frame. And that's it in a real quick overview. I'd be more than happy to connect with anybody if you would like to take a deeper dive, or we have more time during questions and answers later. Thank you.
Thank you so much, Roz. Turning it now to you, Cheryl, who directs the Child Welfare Agency at Port Campbell Tribe, to share about her assessment.
Thank you so much, Anna. I was just going to do a quick overview of the Port Campbell Slalom Tribe for anybody who is not familiar with us. My name is Cheryl Miller. I'm an enrolled member of the Assiniboine Sioux Tribe from the state of Montana, and I'm the director of the Children and Family Services Department here at Port Campbell. And Port Campbell is known as the Strong People, and this is a picture of the longhouse located here on the reservation. Next slide, please. We've had the Port Campbell Slalom Tribe has had the Kinship Navigator Program itself since 2016. This is just showing one of the gatherings with all of our families in the Longhouse. Next slide, please. So we were established in 2016, and our Kinship Navigator here, as it says, we determine the immediate needs of the families. We help both formal and informal kinship families, and we work with the placements on all of their needs to sustain the placements, make sure that they have stability and self-sufficiency, and get all the resources they need to adequately care for themselves and the child within their home. Next slide, please. Along with this, cultural incorporating our culture is extremely important to Port Gamble. And what we do with a lot of our activities is we incorporate culture into it, whether it be drum making, traditional talking circles for support for our kinship families. We've done cedar weaving, wool weaving, drum and rattle making, and we also have classes that the kinship kiddos can participate in as well. And this has proven really successful within the community. And we also open this up for other community members sometimes if we're not having specific discussions or intense talking circles or anything. So we try and be inclusive of the community and get them involved as well. Next slide, please. When we first started this program, we had a wonderful Port Gamble enrolled elder as our navigator. It was a good fit for the program. She was considered a grandma in the community. She had a CDP license, so she was able to really do some good work with the community, and everybody knew her. She has since retired, and we're really sorry to see her go. But we have another wonderful kinship navigator in Star Hagen, who is also a Port Gamble Sklallam member and who's worked for the tribe for over 20 years. So she's very familiar with the families in the community, the needs of the community, and works really well within children and family services as we use a wraparound service approach for all of our services here at Port Gamble. Next slide, please. We have a campus-like setting, as I just referred to. Included in that, we have Together for Children, a maternal home visiting program. We have TANF. We have SNAP. We run a SNAP food program. We have our clinic has a complete medical as well as mental health and substance abuse treatment options, dentistry. We work with the education department, the ECE department, child support. Everything is located centralized, so it's very easy for our kinship families to access service in a wraparound service approach with all of the services that we have here, many of them located within the Children and Family Services building. Next slide, please. This is one of our pictures of one of our brochures that we share with the community, and we do a lot of outreach. We advertise in the tribal memo, the newspapers, word of mouth. We do activities quite often, and STAR also reaches out personally to families, and we staff with ICW and our foster care coordinator. Port Gamble is Direct 4E, and so we can license our own homes, and we just had our Family First Prevention Services Plan approved. We do a lot of prevention work here in the community, which has substantially lowered our caseloads. And like I previously mentioned, we also work with informal as well as formal kinship placements. Next slide, please. This just tells a little bit more about our services, and a real enhancement to our Kinship Navigator program was our partnership with ALTSA for the Lifespan Respite Grant, which has also really helped our kinship families and also allowed us to provide some respite care for elders who it's just a great partnership. When we developed our needs assessment, which if you could bring that up, that would be wonderful. We worked with Washington State and Roz quite a bit on this, and we tried to make it simple for our. Are you bringing up the needs assessment?
Just continue talking, Cheryl. We'll find it and put it up.
Okay,
Here it comes.
thank you. There it is. When we developed this tribal needs assessment, we looked at making it easy and not overwhelming for our kinship care providers. So we did look at the model that Washington State used, which is an excellent model, the one Roz just shared with you. We shortened ours a little bit to really hit the points that we felt were essential to providing good support to our kinship families. Next slide, please. Ours is much like the one Roz just shared, demographic information, where they live, etc. We also wanted to know what income assistance they needed. And this is why we included this. We do run our own TANF program, and we have a lot of resources right here. So that's why we included the income assistance. Next slide, please. This section was all about the kinship child, and we just wanted some more information. Port Gamble's extraordinarily lucky in that it's a small community, so we all know the families and we all know the children. We know their names when they come in for services. So it is easy sometimes for us to recommend services or really listen to what the caregivers and even the children, what they feel they need to be successful in the home and to make sure all of their needs are met with this assessment. Next slide, please. This again just asks about what the relationship to the child is. How would you, the physical health, the behavioral health. This just goes all over that so we can make sure that we are providing the services that they need. Next slide, please. Again, this is more about the child that's being placed in the home, about if they're on an IEP, if they are a 504 plan, if they need academic support. We do referrals to our education department, which is also located here at the tribe, and they have tutors, they have education support people who actually work in the middle, elementary, and high schools with the Port Gamble Slalom children. Next slide, please. This is just some general questions about the caregiver's health to see if they need any assistance or if they would require respite care because of any health issues they may have or if they have to go for any testing. So this just helps us better to assess how we can better support the family. Next slide, please. Here is a little more of the needs assessment, really working with the families to see what their housing needs are, what any concrete good needs are, if they need a new bed for the placement of this child, if they need some safety things in their home, like a gate around the wood stove or whatever they need, we try and help them get so they can be successful. And we also help them if they have any food insecurities. We give them options, seeing if they're eligible for SNAP. We have a food bank here at the tribe, school lunch programs, etc. So we try and hit everything that we can to make sure that we're giving them the support that they need. Next slide, please. Here again is just more of the services of if they need help with that, if they're currently on that, if they need more information about that. So again, this is just assessing what their needs are to make sure we can meet those needs. Next slide, please. This just keeps going on, accessing what they need, talking with them about respite care. If they would require respite care, we have them work with our foster care licensor and our child welfare team. And we also have an excellent youth program here that has a lot of activities and even some overnight activities for our young adults, our older kids, and they have activities almost every week. So we try and encourage that with the homes, with our kinship homes as well. Next slide, please. again, this is just more about what we feel or what the caregivers feel that they would need. We talk to them about any counseling or behavioral health counseling that may be needed, groups or training. We do a lot of training, and we work with our families to see what they need and get their input with it. We've also done referrals to our maternal home visiting program. We have in-home services that our child welfare team works with, and we do have a legal aid service here at the tribe once a month that our clients that we do referrals for, and they are not charged for that service that we have a contract with. Next slide, please. The services below are from the needs assessment, saying what they need, and we have them rank them from the top 3 to 5 needs. Obviously, if they feel real strongly and feel that they need more than 5, we can absolutely work with them with that. But this gives us a really good overview of what they feel their priorities are and what they would like or feel that they need to have the child successfully placed in their home. Next slide, please. The goal setting is much like Roz just talked about, what they would like to work on, what they feel they need help with, if they feel that a goal has been completed, or they feel that they don't require any more support services from that. We found that some of our kinship homes require very little support. We have some kinship homes that require a lot of support, and that's okay. That's the whole purpose of this needs assessment, is to assess every single family and their needs and get it right. So we make sure that we are supporting them. So this just continues, I believe, on the next 2 pages. And we made our assessment a little bit shorter than the states. Some of our families were completely overwhelmed by a lot of paperwork, and we narrowed this down a little bit, and we wanted it to make it very user-friendly when they did it with our kinship program manager. So that's the tribal kinship tribal assessment for our needs assessment. I probably went really fast, so I apologize about that.
Thank you so much, Cheryl. That was
Thank you very
great. And you know, when we joined the Zoom link for the meeting at the top of the hour for the next 30 minutes, I want to delve into a little bit more about how you culturally adapted it and the questions you omitted from Washington's assessment, because I think that's really interesting too. So thank you, Cheryl.
You're very welcome.
And it's my pleasure now to turn it over to Bloomworks, who has been developing with talking to a lot of stakeholders and doing a lot of research and engagement to develop a kinship assessment tool for licensing for those kinship caregivers who are becoming licensed as foster parents. So I will turn it to you, Assad.
Thank you so much, Anna. Hi, everyone. My name is Asad Bandiali. I'm a user experience researcher with Bloomworks. In the next slide, we will look at the agenda for these couple of minutes that we have together. So we'll first start off with who is Bloomworks. Then we will go into what is the Kinship Caregiver Assessment and look at a couple of examples of the work, and then go into how you can learn more about that. And so who is Bloomworks? So we are a human-centered design organization that centers people in their lived experience when working with governments and nonprofits. We primarily use qualitative research to develop deeper understanding of their needs and pain points to design solutions and recommendation. Our experience in child welfare has been working with a number of different agencies and nonprofits at the national level to improve child welfare service across the US. Some of our recent work includes researching national standards for kin placement and working with Washington State on the 6-month project to work towards a kin-first culture. We also recently completed a project with them to gather community feedback on kin-specific licensing rules. The next slide shows the team that worked on it. We have a number of researchers and product managers that worked on it. And later during the Q&A, you'll actually get to meet a couple of my colleagues as well. So now digging into what is Kinship Caregiver Assessment. This is a tool to assess and approve kin caregivers for caregivers home for placement. And it is important to note that the assessment is used for formal kin caregivers, meaning those caregivers that have interaction with the child welfare agencies. There are two parts of the assessment. There's the caregiver discussion questions, and then there's physical home safety questions. Now, the caregiver discussion question focuses on kin caregivers' ability to meet the needs of the children. The physical home safety questions ensures the safety of the physical space. To note, the Kin Navigator program, as we learned from Washington and Port Gamble, serve both formal and informal kin caregivers. Now, how did this work come about? Really, the challenge was kinship assessment varies widely across child welfare agencies. In some places, it requires to meet foster parent licensing standards, which creates a barrier. Really, what this means is the licensing requirements has to be met regardless of being a relative or non-relative. And so in October of 2023, the US Administration of Children and Families published a ruling, a final rule that allowed states and tribes to develop their own licensing standard for kinship foster care. And thus, in partnership with Marina Nitze and the Child Welfare Playbook Working Group, our work started by first understanding how kin caregivers were assessed by different states and different jurisdictions across the US. And then from there, we were involved in the development of kin-specific foster home approval standard, and the caregiver assessment is part of that. So what were the goals for this work? Really, for this kinship caregiver assessment, it's to support and strengthen families to keep children with their kin. It's also to prepare the kin caregiver's home and family for the placement of the child and providing them the support they need in order to meet the needs and keep them safe. Now, who did we speak to through the development of this work? This map shows all the different jurisdictions that we spoke to. We spoke to approximately 400 participants across the US, which included agency staff, kin caregivers, and subject matter experts. Now, what did we make? We designed templates for the child welfare agencies, and 3 templates in particular. So we have the Kinship Caregiver Assessment form, we have the agency training guide, and the assessment question bank. So I'll start with the first one. What is the Kinship Caregiver Assessment form? So this is a form that was designed to assess kin caregivers during the home study process as part of the licensing. The form helps determine how the agencies can support and prioritize with kin caregivers. The form is not to be filled out by kin caregivers, but it is designed in a way where they can understand it and they can expect what's going to happen during the assessment. Now, the agency training guide was created to accompany the Kinship Caregiver Assessment form to actually train staff and provide guidance on how to conduct the assessment and what the reasoning and purpose behind those are. And thirdly, we have the Kinship Caregiver Assessment question bank. And really, this is really a tool that allows agency to select and edit questions as they're creating or updating their own Kinship Caregiver Assessment forms. Now, what were the guiding principles that helped us develop this? And so through our research, we identified the following guiding principles for developing the form templates. So center equity, trauma-informed care practices, promoting transparency and problem solving, designing for simplicity, not only form, also a guide, being specific yet flexible. And so in the next set of examples, you will see how some of these principles were actually brought into action. And so the first example you'll see here is really calling out one of the fundamental changes in the form was the use of second person, the you, which helps making it more conversational. Now, this is an example, and I had mentioned there's 2 parts to the kin caregiver assessment. This falls under the caregiver discussion questions, which again is looking at kin caregivers' ability to meet the children's need. So, what are your preferred methods of communication? If you prefer, how do you generally prefer? This change in going from third person to second person really centers the kin caregiver. The language is centering the kin caregiver. Now, the next example we'll look at is around providing support examples. This is another addition we did to the form. In this example for transportation, as we asked them, will you be able to transport the children to medical appointment? Here, we're giving them examples of what are the things and then perhaps can jot their memory, and then they can actually have that conversation. And a note, our North Star in all this work was to enable, not to create barriers. Okay, so the next one, the next slide will actually show us an example of the agency training guide. And so here in context, so in this example, we have the in context guidance, so the annotation, where we are highlighting what is important to know for this question. And we're explaining that it's important to know caregivers' ability and willingness to transport the child, but it also states that not having a drive-in license is not an automatic disqualification as long as they have a plan. And so really, this is a tool that's being used to train and guide staff as they're working through and understanding what is the core purpose for these questions. Now, the next slide will actually showcase a different part of being flexible. It's recognizing that there are regional differences. There are geographical differences that have to be accounted for as we're asking these questions and we're trying to do assessment. So in this case, for example, around heating and cooling, does the home have heating and or cooling that is appropriate for geographics and the region, right? And then we also provide a number of examples, but the options include different forms of heating and cooling mechanisms and not solely limited to a standard HVAC system. And this is critical to be able to customize it for the different population we're talking to. The next slide will actually show us another example, and this is within the physical home safety question, looking at standards and to ensure the question is looking at what is required and possible, and we're not going towards perfection. So in this case, the question is the home free of insects and rodent infestation? And in the annotation, we're actually defining the standard is infestation, specific to infestation. And so we're able to now explain what those standards are, what is required, and what is possible. And so the last example we have is actually around sleeping arrangements. A lot of forms have unrealistic hard lines, expectations that a child has to have their own room from the start, but perhaps maybe it's okay to start on a couch or sharing room if space is safe. Really saying what is fundamental purpose of the question is really to ensure, as the question says, does the home have a safe sleeping space with bedding for your child? And then we have guidance. What does that look like for a child that's under 12 months? And what does it look like for a child that's over 12 months? And then the next slide is, again, I just want to reiterate, we just saw a couple of examples from the Kinship Caregiver Assessment form. I'm bringing this guiding principle slide up to say that this is what was centered in our team's mind as we were developing these templates. And these are principles everyone can keep in mind and incorporate into their work as you're doing the development or incorporation or implementing different types of form. And with that, sort of our last slide is, if you're curious to learn more about the Kinship Caregiver Assessment tool, we have reference here, along with the National Kin Model Standards and also the Child Welfare Playbook Working Group. The links will be dropped in chat and will come back out as a follow-up. And just on a last note, there are agencies at the moment that are adapting and putting the Kinship Caregiver Assessment form into practice as we speak. And with that, thank you so much for all your time.
Thank you so much. It's so wonderful to have such a comprehensive tool and the explanations of why certain things are being asked and not being asked. So it's very helpful. I'm also dropping in the chat new 504 regulations, section 504 of the Rehabilitation Act of 1973, which for the first time specifically calls out child welfare agencies. And I know that it was kept in mind by Bloomworks and partners in developing this tool. And I'm just elevating it for you all in the chat. So now it's my pleasure to turn over our webinar to Robin Wind, who is the Grand Voice Coordinator here at Generations United. She manages a national network of caregiver advocates, 80 plus strong, and she is joined by Anna Marie White, one of those fabulous Grand Voices. So thank you both for joining us and sharing how to approach the families thoughtfully and respectfully. So appreciate you two.
Thanks, Anna. Hi, Anna Marie. It's good to see you again. So I'll just very quickly tell you a little bit about myself, and then Anna Marie will. My name's Robin Wind. I live on the Muskogee Creek Reservation in Oklahoma. Before I came on staff with Generations United, I worked primarily in tribal Indian child welfare, mostly in foster care leadership. And I have been caring for my 10-year-old grandson since he was 4 months old. And I came to Generations United looking for help when I needed to learn how to advocate for myself. So, Anna Marie?
Hi, it's good to see you again, Robin. Hello, everyone. So I am actually on an iPhone. I do not have cell service or I don't have Wi-Fi. So I'm hoping that I'm on here and everybody can hear me. So I am by profession an Indian child welfare expert. That is my daytime job. I am an appointed guardian ad litem in a couple of the counties in Montana. I live in a very rural part of Montana. And I also own White Horse Forestry. And recently I've started to say that because people always ask me, do I have any free time? And I say, well, this is what I do when I'm not at my other job. We do have 3 of our 7 granddaughters in our care. They have been with us since the day that they were born. And we did, in fact, have our third-party parenting rights awarded to us just a couple of years ago. So we are actually their 3rd set of legal parents. And I have been part of Generations United and Grand Voices, I think maybe 3 years. It's flown by. So, and it's just been one of the most incredible experiences. So I'm just really happy to be here with you all today. Thank you.
Thanks, Anna Marie. So I know that you and I come at how we became caregivers differently. My little guy was placed into state of Oklahoma's custody with tribal intervention when I got him, and I had 24 hours notice. And so I would be considered a formal caregiver because he was in custody. But yours is different. Can you tell us just a little bit about that?
It is. So we purposely, some people say defiantly, stayed out of any involvement with the state. We absolutely refuse to have any involvement by the state of Montana. Our daughter had been traveling back and forth from the state of California to Montana. So in fact, we could have been involved with both of the states at the time that our first granddaughter was born. I know that we'll talk about this maybe later, but culturally it is for me. So I am Cherokee. I am also part and descendant of 4 other tribes. It would not have been acceptable to my family if I had asked for any type of formal intervention. In fact, when I went to my father to let him know that we were going to have this brand new little baby indefinitely, he said, well, good for you. Do a really good job because that's what we expect from you. And when I asked our daughter how long did she think that we would need to help her, her response was, until when? That granddaughter is now 14 years old, and her twin sisters are 12. So we stayed out of the formal system. However, a few years ago, their biological father did appear in their lives, and then we were completely involved with the state of Montana, and it was a district court judge that made the final determination, luckily and with a lot of hard work to our benefit. So yes, it was very different. And both ways are very scary. So it's just listening to the other speakers this morning. It's incredible that we survive any of this. So I am here to learn more than anything else, and hopefully I share something that's of value.
Anna Marie, with me, and I don't know if you had to do a home study like I did, but for what I did for a living was licensed foster homes. So I knew in my head that I was a good placement. I knew I was going to pass all the background checks. My home was safe, loving, nurturing, but I hadn't had a baby at the home in 20 years. We had a pack and play from his older sister, but that wasn't acceptable. We didn't have a car seat I didn't have a car seat. So I know for me, it was extremely stressful, and I was very concerned because they told me if you can't take him in 24 hours, he's going to be going to somewhere else outside of the family. And I know that once a child is placed somewhere else, it's hard to get them back. So the people who came in were very sweet, but I was still scared and still nervous about, they looked at everything. They looked outside. They wanted to know my backyard wasn't fenced all the way, and they wanted to know how I was going to keep predators away from the house. And it was just really, really stressful for me. So what approaches do you think would be helpful to assess kin caregiver needs that wouldn't cause so much stress?
Mm-hmm. So I have a lot of opinion on that because in my profession, and that's something that I'm looking at as part of my investigation in preparing for court. I do take a look at all the reports, and oftentimes I'll be looking at the reports, and the standard that's being set is so high that it's almost next to impossible. So I think that before any physical assessment is done, we need to take a look at the family structure and who is this family and what in their family is dictating. I heard somebody speak about sleeping arrangements. In some families, it's absolutely fine to have 4 children in a bedroom. They've got 4 girls and they all do fine in one bedroom. In other families, the baby is in its own room a couple of months after it's born. So I think that it's very important that we're not dictating from the top, that we're dictating from, or not dictating, but we're assessing from where we come in. And we are relieving families instead of imposing what we think everyone else should be doing. Because I'm certain that I do things that other families would be appalled by. We are outside every single day of the year, even when it's sub-zero. And there are families that think, why would you subject your poor little girls to that? But it's fun. And this is where we live. So I think that that's part of it. We need to look at the families first and go in with, I've heard this before, do no harm. How can I help? How can I walk alongside?
Speaking of harm, let's talk about that. And I'll just, again, give another example of my own self. So I have issues with my shoulders. And I've had 10 shoulder surgeries, but when my little guy was very small, one of my shoulders kept coming out of joint, and I could not keep it in, and I needed surgery to keep it in. But I waited until he was able to walk because I was afraid that they would say I couldn't take care of him on my own because I was single and it was just he and I at the home, and I was scared about that. What approaches do you think might be harmful to kin caregivers when assessing?
Mm-hmm. Well, I think again that if we're assessing from the top down, we are just setting these families up. We are setting up probably the best alternative outside of an extended family to care for the children that are in need. So I think that we need to And one of the other speakers talked about geographically, are we looking at realistic situations and realistic circumstances, and we're not imposing any of our own personal biases, and we're not imposing any of that top down. Earlier this morning, I was in a meeting and our governor was speaking, and our governor happens to be a billionaire. And he sees things very differently because of where he comes. So it's difficult to reach him. But I was just thinking, the way I am looking at our billionaire governor speak is probably how some of our families are looking at the professionals that are coming in to assess them. And there's just we just can't have a comparison tool. I think we just need to be realistic. And again, just look at the family for what the family is, who they are, and how truly can we assist them, and not overwhelm them. I think it was Cheryl that said it's so overwhelming in the beginning with all the paperwork. Let's not overwhelm them, because I know when I'm overwhelmed, I just shut down, and it's not helpful. And then if a family's shutting down while we're trying to do an assessment, potentially the family could seem uncooperative, but it really is not that. It is just, this is a big deal, and it doesn't need to be a bigger deal.
Right. And I heard you mention our own biases, and that's so right. I mean, I have on my wall in my home, because we are citizens of the Muskogee Creek Nation with Cherokee descendancy, I have stickball sticks on my walls, right? And so in addition to other artwork, but I was asked, well, what are those? Are those weapons? And I'm like, I guess they could be if you're playing stickball, but so it's just, and even the way sometimes, and I've heard you mention this before, Anna Marie, but the way you come into someone's home and how you're dressed, because I would always, when I went into license a home and did my first walkthrough, I would always be in jeans, in a shirt, and definitely t-shirts, because I've been chased by mean dogs before, or tennis shoes, right? But I think that we need to meet people where they are, in order to build, that trust, because some communities don't have a lot of trust for someone coming into their home to see how things are going. So I have one more question that I would like to ask you, and that is, what advice would you give to someone who's developing or updating their caregiver needs assessment tool that maybe we haven't already covered?
So I think the last speaker that spoke, he talked about language a little bit, or the use of words. I think that that's probably the most important thing in written form, is the words that we're using with the families that we are assessing. I think that there has to be careful consideration. Geographically, it would be very important. I know that I've been lucky to travel to the East Coast to be involved with different things with some of you here today. And in private conversations, I have learned so many things. And I'm originally from California, from the West Coast, and I thought that moving to Montana was a culture shock, but going to the East Coast. So I know that, or I think that language can be very harmful. So I think that language needs to be considered, the use of words, how we're using it. I loved how the last speaker talked about asking the question you and using the word you, because they are human beings. We are human beings. We want to be visible. We want to be heard. We need to be seen. So I think that that's very important, is that if I am sharing something with you in written form, again, that it be helpful and not harmful. I liked how Cheryl talked about minimizing. I think there's a 13-page difference between the state of Washington and the tribe's assessment tool. I think that's awesome. I think that only absolutely necessary questions are helpful. I think that shortening anything, if something doesn't matter, then it should not be a part of. I think that anything that we can do to ease the burden on any family that's being assessed is wonderful. And then I had thought of something else while you were speaking, Robin. I think, or maybe it was the other day, you said something about, how can I help you? And I think that that's probably the most important thing, is that how can I help you? And this assessment tool is part of how I can go about helping you. So I think that that would be my advice, is that um, this is why I'm doing this, or asking you to participate with me in doing this, so that I can be helpful to you.
That's great, Anna Marie. And we both have been on other projects together where we know that families and communities know best how to help themselves and the children in their care. So just listening when we're telling you something, or one other thing that I noticed, and I can't remember whether it was with Fort Gamble or Washington State or both, but I noticed that there was a spot where you could say, I need help reading and understanding this form. So that's also very helpful, because a lot of us, English is not their first language. So and maybe they didn't have the chance to go to college and get their master's degree in social work. So yeah.
Yes.
So Anna Marie, I want to thank you so much for joining me today, and I'm so happy to see you again today.
Oh, so fun.
And,
thank you.
and that'll do
Thank
it
you.
for us.
Thank you both so much. That was really, really helpful. And I look forward to hearing more from you in the next 30 minutes. We are going to switch over to a different link, for the sole purpose that on that link, you will all be able to come off mute, ask your questions directly, and we can have more of a dialogue. And this format is webinar, so we cannot, as participants, come off of mute. So we hope you will join us on that link. I'll ask the team to drop it one more time. So what you're going to do is you're going to get off this webinar, and then you will get on to, hopefully, the Zoom link for the meeting format. And all of our panelists are joining us, and I thank them so much before we move over, for joining us today and sharing all your wisdom and your great tools and your generosity. Because we're all in this together, and we want to do the best we can and serve the families in the most respectful and helpful way. So thank you again for joining us, and hope to see you over on the Zoom meeting link.
Yes, absolutely. What we did, Anna, was really look at what the cultural, the values of the tribe were. And there were some questions on there that we felt as a tribe would be offensive to some of our grandmas and aunties. I believe this was specifically about sexual preference, but I could have two things mixed up. The most important thing for us was making sure that we were able to provide the cultural component that's so important in the tribal community, and hitting all of those points within the assessment so we could really work with the families. We did not want to make it overwhelming for them. We wanted to make it easy for them. We really worked hard within Port Gamble to get rid of some of the stigma of ICW and asking for help, and the fear that came along with that. There was a historical fear of, if I go in and I ask for help, they're going to take the children out of my home. And we have worked very hard over the last probably 6 years to turn that mentality around and try and give the families the support that they need to keep them out of the court system. And it's been really effective. For instance, when I started here in 2012, we had over 60 plus kids in dependency care. We have 10 right now and 21 guardianships. And, we also have a pretty steady work set of workers here. I don't have a lot of turnover, which is sometimes different than other tribal and certainly state settings where you go through a number of different workers. So we just incorporated cultural events and just tried to make it so easy for our families to come in and ask for help. Since we do live in a really small community, I hope that that answers your questions. And we did shorten the paperwork because we just felt that a lot of our grandmas and aunties and even grandpas would not want to fill out 20 plus pages of paperwork. They fill out so much paperwork anyway. So
Cheryl, I wonder, do you ever share the assessment tool with the caregiver as you're going in, before you go in, or as you're going in?
we do it with them.
Okay.
So it's more of a conversation
Mhm,
than fill this out. So
mhm.
and that's been really productive because then I think that they feel that their voice is getting heard and and we want their voice to be heard. They're the ones taking care of the child and they need to be honest with us about what services that they really need so that they are successful.
Mhm, mhm. And Assad, I believe, do you all recommend that your tool be shared? How's that look when you're using your tool?
Yeah, absolutely, absolutely. So we do recommend that the tool be shared with caregivers if at all possible ahead of time so they are aware. But the idea is that it can be done with them, and it has to be a sort of a conversation. And so the modality can change. Some have said they can do it over the phone, they can do it in person, but really we want the caregiver to be aware of what they will be going into the conversation as well.
Thank you. And is that the same approach you take, Roz? Kind of a conversational approach?
Absolutely. And it can happen in the caregiver's home. It could happen in an office. It could happen over the phone, just whatever's most convenient because it is pretty lengthy. And if they have lots of kids that are running around, it's a little hard to concentrate on, so it could also break it up, right? Get some of the demographic info first and then add some of the other pieces in later. Just meeting families where they're at.
Thank you. And I see Wendy has her hand up. So Wendy, what do you have for us?
Buddy, I am Wendy Crows. I am the manager of a grandparent raising grandchildren program in northern New Mexico. We're in 4 different counties, in rural counties. We are just beginning over the last 6 months to experiment with our own evaluation and assessment tool. We're contracted with the state of New Mexico Office on Aging and have used theirs, but decided we wanted to use our own and create our own. And ours is 2 pages at this point, and it's all conversational. Here's my question. Our program started 12 years ago, and we don't have any discharge criteria. And so we've got families in our program that have been in for 12 years, 10 years. And that's new to me. Any prior work I've done, there was always a beginning, a middle, and an end, and a preparation for an end, and using goals to establish an end. And grandparents raising grandchildren, grandparents and kin is very unique. It's not like anywhere else. And so I would just love to hear if this is an appropriate question. Do other people have discharge criteria? How long do you keep people on average?
Well, you raise an important point because, a lot of these caregivers, and the data shows this, are raising the children for a very long period of time, and needs change from when you're raising a toddler to when you're raising a teenager.
Yeah.
So may I turn it to you, Roz, for any thoughts on that?
Sure. Absolutely. This is real life, right? So we're trying to fit a snippet of time of a real life situation where, you could be raising families for years. I have worked with grandparents that end up being great grandparents, raising another set, you know. So it could go on forever and ever. But as far as like a case management caseload, you know, here we are trying to fit our, you know, round peg in a square hole, or, you
Right.
know, all of those kinds of things that, you know, like, let's make this real. Let's make it work. So that's where I like our assessment and our model, because we know that, right? We're working with real people here. The kids are going to be there for as long as they're there. They're not going to age out because they're not in, oftentimes they're not involved with the formal system. They might live there until they're 30, who knows? So the way that we can kind of manage that in a more manageable way is that we have open and closed time points where we're working in a case management model. Like, there are some needs that have been met within that time frame. And if they have more needs, then you can open another case and you can continue to work with them for as long as needed. Or they could go to a lower level of help where they can just reach out whenever they need help. You know, you need a refresher because now you have a teenager that's starting to drive where, you know, you didn't have issues before, and now it's a whole new set. So the caregiver can reach out and say, hey, you know, it's been a couple of years, but I really need help. So we try to make it as much as possible meet the needs of the families for the whole length of time that they are a family. Hopefully that helped answer some of the questions, because you know, I get the caseload thing. It doesn't work.
Thank you, Roz. And Lisa dropped a helpful chat in there as well, Wendy. Assad, for your assessment, it's different than Cheryl's and Roz's in that, you know, you're assessing to license for foster care. So you're assessing to license to be foster parents. And that is a finite period. You know, hopefully they will be exiting to guardianship or adoption, or reunifying with the parents. So it's a finite period. But I want to ask you about specifically the disability pieces of your assessment, because, you know, like I dropped in the chat, the new 504 regulations specifically now call out child welfare and they can't discriminate. And so how did that factor into some of your questions? Because I know it can get tricky because, because it can. Anyway, turning to you, Assad.
Yeah, absolutely. Can I tag in one of my colleagues that
Absolutely.
come in? Yeah. So let me call them out first. We have Sonia Silva, we have Anissa Perez, and Katrina on the call.
Thank you all for joining us.
Hi, I'll jump in. I'm trying to find it in our assessment as we talk, but this definitely came up when we were asking questions about caregiver health and kind of that everyday functioning. Like, those questions came up in terms of, is this caregiver going to be able to effectively be a safe home for this child? And so we were careful there in terms of like what really needs to be asked, and what are things that you know, maybe a caregiver felt was excessively invasive in terms of lines of questioning. And then it's really about like, what are they able to do? What might they need support with? Like, somebody might, I believe it came up as an example, like somebody might have a support worker who comes into their home a couple times a week, and like, they should not be excluded just because they need a support worker to assist with, you know, some of their daily living tasks. Like, they, you know, they can still be a suitable caregiver for that child. So those were some of the things that were coming up around it, and really being careful to, again, look at like what support is needed versus you can't because you need some form of assistance, knowing that most people need some form of assistance in different ways.
So you're basically looking at the ability to parent, but the ability to parent may exist in, you know, you're in a wheelchair, but you have ways in the home that you can do the caregiving that needs to be done. while staying in your chair.
Yeah, and that came up as well in terms of, who else is in the household? Who else might they have as like, adults who are around to assist? How old is the child? Like, that might not be as much of an issue for like an older teen in the house where they're not having to pick up and lift a child, every as frequently. So there's a lot of nuance in there, which many workers as well that we are speaking to acknowledge that, these are things that they're considering when asking these questions.
Yeah, so you're going back to Robin and Anna Marie's point about really looking at the family. And I bet, Robin, you saw some things. Because Robin did license homes as well. Anything you want to share on this theme?
It is meeting the family where they are, and fortunately, both of the tribes that I've worked for, we're the bigger tribes, and we were able to license our homes. So we did adapt licensing standards, but it was always a fight with the state. Sometimes it was, well, they can't sleep on a pull-out, or in my instance, a pack and play. Well, that's all I've got, and you're going to give my baby to somebody else if I don't come up with a crib. I'm a social worker. I'm broke. So, it's just meeting the families where they are and being willing to, because we need to move away from the bias of the apple doesn't fall far from the tree. When this occurs, especially if the child is taken into custody, it is in my case, it was a shock. And in a lot of people's cases, it's a shock. And so we're trying to navigate that as well as getting car seats, diapers, formula, and everything else we need so that you don't place our child with people who aren't related to us.
Mm-hmm. And that's such a big component too. I know of the Bloomworks kin assessment, that you really agency should go in, and if there's not a crib, pay for a crib, find a crib. And I know that's a huge part of Washington State and Port Gambles as well, is really helping with whatever need there is in this home that didn't expect to be raising this child. So thanks, Robin. Cheryl, I see your hands up.
Thank you, Anna. I just wanted to comment on a couple of the questions. We also don't have a time frame. Obviously, if it's a formal placement through child welfare, the case may close, but that doesn't mean if the case closes and that the placement's obviously no longer needed, then we step out. But we always leave the door open for people to come back in if they need help. That includes all of our families. We also just got approved to license our kinship homes. We have submitted the kinship licensing standards for approval, and we have a couple of typos that we need to fix for formatting, but they have been approved. And then we also received approval in March to pay our kinship homes the same rate we pay our foster care homes. So previously, a lot of our families depended on TANF for if the child was eligible for SSI. Now we can license them, which is a little bit less restrictive than our foster care licensing, but not much. And we really work with them. But it is a big deal to be able to license them as kinship homes and to pay them the same rate as we would for foster care placements. So we're very extremely excited about that. I also saw a question in the chat, but I don't want to rush ahead, so I'll wait till that one's formally asked.
Thank you, Cheryl. Well, actually, we did get quite a few programmatic questions, especially for you, Cheryl, while you were presenting too. So yeah, if you want to tackle this respite care question.
Yeah, well, obviously, if they are formal kinship placements, we have respite care homes that we can, we're direct 4E, so depending on the circumstances, we can get reimbursement for that. We also have a grant with Washington State, the Lifespan Respite Grant, that does allow us to have so much money from the grant to be able to pay for respite care, which is extremely needed, just to give the caregivers a break, give them some own self-care so they can come back and be the best caregivers that they can be. And I also wanted to mention, somebody said, with the kinship programs and the support programs, we've been able to do so much to help some of our families that we would have never been able to do without that funding or using hard dollars from the tribe. We converted a bathroom for one of our kiddos who is living with his grandma. He's in a wheelchair for spina bifida, and her home did not have an ADA shower and bathroom, and he's a teenager now. So we modified a bathroom to allow him to be able to be more self-sufficient in the bathroom and get in and out of the shower without her help, because obviously she can't lift him. So I just wanted to say that with so many of these programs, we are taking it, not just us, but a lot of the other organizations are taking it to the next level and really looking at how can we make their life easier? How can we give them the tools that they need to be successful? And how can we how can we do this? We worked with our housing department. We just use all the resources we can find to make things happen. But we're very excited about our kinship licensing. So I just
As
wanted
you
to.
should be. Thank you, Cheryl.
You're
Yeah,
welcome.
you're doing great work there. We did get several programmatic questions for Cheryl, and we really want to focus this 30 minutes on the assessment piece because that's what the webinar was focused on. But I will direct folks to read the summary that NICWA did of Cheryl's program, her Kinship Navigator program, at the tribe, and I'll ask one of the team members to drop that in the chat. We got another great question. I'll answer you just quickly here in terms of the licensing. So you're asking if kinship care families have to be licensed to be paid the same as foster parents. So there's a new federal rule that went into effect late last year, and it allows for states to take the option to create separate licensing standards for kin, which Bloomworks and we and a lot of people have created a model on that. 6 jurisdictions, 3 tribes, including Port Gamble, are pursuing that or doing that. And so if they can use separate standards, license them as foster parents, and pay them this, and then they must pay them the same. So I think in answer to your question, yes, they have to be licensed, but they can be licensed under separate standards to be paid the same, and they must be paid the same once they're licensed or approved. But moving back to the assessment piece, we got a great question, which is how did kinship caregivers themselves, how were they consulted in developing these assessment tools? And I will turn that over first to Bloomworks, because I know that you talked to hundreds of kinship caregivers in developing your tools.
Yeah, absolutely. I'm actually going to ask my colleague Anissa to speak to this.
Sure. So we were, thoughtful in our recruitment process and making sure that we were, representative of many groups, including folks who are marginalized, who have other languages as a first language. And, I think as you saw, Asad showed the map. And so we were able to speak to kin caregivers from many states. I don't know the exact number right now. And so we had, Zoom opportunities to, speak to people on Zoom. We also went out to the communities that we're each, located in, or at least a couple of the communities that we're in. And we're able to put flyers on bulletin boards and see, to recruit folks like that, or, speak one-on-one in the community as well. And so that was a wonderful, learning experience for us to be able to speak to, kin caregivers from many different walks of life. And we learned so much, and we were able to incorporate that into the form. And so that was exciting. And then we also have a participant memo that we, so after we've spoken to the different folks, as the kin caregivers, we said, hey, this is what we learned. This is how, your the information you provided us, this is how it's kind of panned out, and, it's become a form. And so we're really thankful for your participation. And so that's what we were able to do.
Thank you so much for sharing. How about you, Roz? How did your assessment get influenced by kin caregivers?
Sure. Well, with our Kinship Care Oversight Committee subcommittee, many of the participants were kinship caregivers. We also had kinship navigators that represent many kinship caregivers, as well as many of the kinship navigators are also kinship caregivers. So we incorporated that from the get-go. And then we also had focus groups that were specifically targeted towards different communities, because we have rural and urban areas and, just a very diverse area in Washington State. So we want to make sure that we're capturing the voice statewide rather than just in one area. So we had these focus groups. We had some Spanish speaking, only Spanish speaking, monolingual participants. We had tribal members participating. So we tried to kind of go across the board and really hone in on getting input and feedback from everybody. And that's the main part.
Thank you, Roz. How about you, Cheryl?
We also shared the initial assessment that we received from Washington State with a group of our relative caregivers, and had them give us feedback on what they thought, what their suggestions were, what they felt was unnecessary in it. And so we worked around that when we created ours. So we did work with our caregivers on that. They're the experts. So
Indeed they are. I'm gonna put Kylie Craggett here on the spot because she's done a lot of kin assessments going into homes in Texas to license them. And Kylie, I'm wondering if you have any tips to share.
I think really I was identifying a lot with what Robin was saying about, taking the family specifically into account and the family needs. Anytime we get caught up in a system that has rules and regulations, and we have workers and employees who are busy and trying to get as many families licensed as possible, it's easy to look for reasons to select a family out. And so, my motto and the staff I worked with was really like, what is the reason that we can license this family? Not what is the reason that we cannot license them. And just that change of thinking was really helpful, especially for some of our staff who were just getting started and who were used to like, well, policy says this. Okay, well, what happens if we can look at a way to get a variance or get something to be able to still ensure the safety of the child, and, be able to license the family. And so that was really helpful. I think also just the relationship building with the state workers who give the variances, who know you and who know your program and who are able to help you in that licensure process was really helpful for us. But yes, definitely getting to know the family, getting to know their specific needs was something that I found to be the best way forward.
Thank you, Kylie. And when we were doing the NARA licensing standards, which apply to kin and non-kin, those were created prior to this final rule allowing for kin-specific licensing standard. We worked closely with NARA, who is the National Association of Regulatory Administrators, or I may have gotten that slightly off, but that's the gist of it. They're a professional group of licensors, and they use the same phrase, Kylie. They said, and it's one of the principles in the NARA model, which is we need to license in, not license out. And it's such an important point. Like, don't go in there looking for reasons not to, like things that could look like weapons, but really understand the family and why they have those things on the wall and who they are. So thank you. And Melissa, if you wouldn't mind dropping in the chat that we have a piece about how to meaningfully engage kin in all these processes and how to compensate them and really value their time. But I would love to end our time together with Robin and Anne Marie talking about any really, send us away with what we really should be doing as kinship service providers in this assessment process. And I'll turn it to you first, Robin.
Okay, so what I would really want you to know is that we love our kids. Like that, my grandson is the joy and the reason I get up every day. He's ornery and he's stinky and he's a 10-year-old boy. But I mean, even when he was a baby and he only slept for 2 hours a night, he's the reason that I'm doing this, right? I understand that my child made some bad decisions, but he's grown now. We want to help you help us help the children, because they're the most important thing. And as tribal members, to us, they are the future of our nation. And actually, all children are the future of this nation. So help us help you, help us help them. Anna Marie.
Oh, that's awesome, Robin. I love that. So for us, our children are our legacy, and we want to do everything that we can to leave a legacy that we will be proud of. We do everything in 7 generations. So 7 generations from here, we want this legacy to be something that we are proud of. But I think that probably the most important thing that I learned during our legal involvement with the court system is that we had a psychologist that was hired. We hired a psychologist to help us through the process. And one of the things that he reminded us of constantly, and we joked and said, that's why we pay you the big bucks, is that he would say, you are the expert on your children's lives, and do not let anybody take that away from you. Do not let the court system, do not let me, do not let the teachers, the coaches. Be present and always speak on behalf of these children, because you are all they have. And I just have never forgotten that. I'm sure he said other great stuff that was helpful, but he gave me back what I thought I had lost because we had become part of the legal system. So I think that the professionals that come into our lives, that if they can understand that they are walking alongside of us and not in front of us, not behind us, but that this is really a team effort. I think that that's so important. So that's all I wanted to share.
Thank you so much. Thank you all. It's been really, really helpful. For anybody who we didn't get to their question, especially I see, some funding needs and some other programmatic concerns, I would encourage you to go to our homepage of our website. The top right-hand corner, it says request assistance. Complete that form, which is very quick. That will go straight to Shayla Bottoms here and Kylie Craggett, who will either answer your question directly, or they will engage some of our subject matter experts and partners to answer your questions. So know that we're a resource. Everything we do is free of charge. We're here to support you, and we so value that you spent some time with us today. And really thank you so much to all the presenters and panelists. We deeply value you.
Thank you.
Thank you.
Thank you, everyone.
Thank you, Cheryl.
You're very welcome.